Look at you guys. Whoop.
Tell
You're
me
the
I was in
IT.
IT that
Yup.
one time.
Yup. She is IT.
All right, kids. Now that we've been started, I'm starting to feel a little. Well, you watch just because we got it going. He's gonna yell, Danny, we need
Yeah,
you.
exactly. Then you guys got more. One of them was 2.
Okay, the little white screen. That means I'm recording.
They come from Quebec or
Well, they don't have a governor on their truck, so they can.
Yeah, their trucks are.
Their trucks
Really?
haul ass. Ours go 82 miles an hour. Seriously.
Well, perfect.
We have
doesn't
people
seem fast
passing
till
us.
you're in the back and someone hits
Yeah.
a bump, then it seems fast. Okay, so you guys remember Scully?
Yeah, she goes, now that you guys got it all set up. What's that about us?
Yeah. Biggest pup.
Did any of you guys have helmets?
I don't know. I will be forgetting to say. I could probably borrow a helmet or 2.
I don't know, you might text her back and ask her how many.
My dad has some.
I could
bring some
I
helmet.
have was like, when I was 11.
So I have, what is it?
Bike
Wednesday.
helmets?
Yeah, I have, like a riding helmet and I have like a motorcycle helmet.
We've got a whole bunch of those.
It doesn't have it.
Yeah, we'll have to clarify with her which kind she wants
Yeah.
and then, okay.
Mine's even DOT certified.
Yeah, cause Bobby has the 3 bikes.
Well, and then
It's okay.
when I was doing all my drifting, car drifting things, I had to have a DOT certified on it. So I'll let you know part of that one. It's okay. Oh.
Okay.
Here it is, like a pen.
No, this is supposed to.
There.
Okay, musculoskeletal. A lot of review type stuff in the beginning. So what is my axial skeleton?
It includes your skull, sternum, ribs, spine.
And appendicular
extremities.
and pelvis. So just the pelvic girdle, not your coccyx and such. Easy way to remember that, appendicular. Okay. So the musculoskeletal system is all the body's bones, joints, muscles, cartilage, tendons, and the ligaments. Your bones are formed of dense connective tissue, store salts, and metabolic material, provide a site for production of your red blood cells, the bone marrow, and your bones are actually very vascular. Your bones actually bleed. So when you get those fractures, femur fractures, the femur itself will be bleeding along with if there was any injury to arteries, vessels, capillaries. So then you also can get blood clots from the bones themselves. Okay? Joints are the places where bones articulate or meet. And then the periosteum is that strong white fibrous material that covers the bones. Okay, so joints bend, muscles move, and the bones are the frame. And cartilage is flexible, so your nasal septum, your ears. Your ligaments is bone to bone. Your tendon is muscle to bone. Might need to remember that. Muscle tissue, muscle is the tissues or fibers that cause the movement. You have smooth, which is your involuntary muscle. Those are the walls of your organs and your digestive tract. Cardiac, the easiest one to remember, cardiac muscle, the walls of the heart. And the skeletal, which is voluntary, controls all conscious or deliberate motions. All muscles that are connected to bones and the tongue, pharynx, and upper esophagus. So your bones are classified as either long, short, flat, or irregular. They're also named depending on where their location is too. So the shape of your bones, like your ribs are flat, the long bone, like your humerus, femur, tib, flat bones, like your scapula. Your bones will heal themselves. So breaks cause soft tissue swelling and a blood clot in the fractured area. Interruption of the blood supply causes the cells to die at the injury site. Cells further from fracture rapidly divide, forming a tissue that heals the fracture and develops into a new bone. That's why anymore you don't always have to have surgery just because you broke a bone, depending on the bone. Okay, so one of the things that gave, so you know how we always talk about the acronyms or mnemonics? MTB is muscle, tendon, bone. BLB is bone, ligament, bone. Another way to try to remember it. So the cartilage is the connective tissue that covers the outside of the bone ends, the epiphysis. And it acts as a surface for articulation, allowing for smooth movement of joints. And the septum of your nose, your ear, your trachea, and connections between the ribs and the sternum. And then your tendons are bands of connective tissue that bind muscle to bone. They allow for power of movement across the joint. Ligaments are the connective tissue that supports the joint by attaching the bone in. That allows for the range of motion. Okay, so with me? 3 types of mechanisms that cause injuries. Direct force, like being struck by a vehicle. Twisting or rotational. Stretching or tearing a muscle or ligament, as well as broken bones. And then indirect force. So when you fall off the porch and you land on your feet, the direct force is your feet and ankle. Your indirect force is, oh, that was a 12-foot drop, and now your femur is up inside of your pelvis. So that's an indirect force. You can break kneecaps, you can break femur, you can break hip, pelvis. That was not a direct hit, it was injured. It's just because of the impact that it took. So obviously, a fracture is any break in a bone, open or closed. 3 types of breaks: comminuted, so complicated. You have more than one break, it's complicated. It has several breaks within the same bone. Green stick, which is very common with your kids. The partial break. Those are the ones that are difficult to see on x-ray. If it's a pretty decent one, you might see it, but a lot of times there'll be a break and they don't see it on x-ray. So then when they come back in for follow-up, that's when they see it, because they'll do an MRI and be able to see it then. And then angulated, just like the word says, at an angle. Where's that one?
Well, to me, that looks a little angulated. Yeah.
That does look. That one looks like fun. No?
Yeah, Gina said she pictures that all the time.
The
meat
meat
grinder?
grinder?
Yes.
Oh.
It was funny because I had walked or read through the book a little bit, and I had seen that picture, and then all about the same time I was grinding a hamburger. That's all I could think of is, great, get my fingernails caught in here. Okay, so injury to bones and connective. So you have dislocations, which means coming apart of the joint. You can't dislocate your femur. You can dislocate your femur from your pelvis or acetabulum, but you can't literally. So it's just the joint is going to get a dislocation. Sprain is the stretching and the tearing of ligaments, whereas a strain is the overstretching or overexertion of muscle. You need to remember the difference. Not all injuries can be confirmed as a fracture in the field. All you know is, unless it's an obvious, there's pain, there's swelling, so it's broken until proven otherwise. Treat all injuries with signs and symptoms of a fracture as a fracture. A traction splint should be applied to a suspected femur fracture. Splinting an extremity will be that one. So rapidly identify and treat the life-threatening condition first. Okay, so you get on scene and you see some guy who had jumped off of the porch, balcony, we'll say. I don't know you get it. And he's got this obvious open fracture, but it's not bleeding. But he's having a panic attack, he's anxious, he complains of shortness of breath. Which is more important? Even the meat grinder. Yeah.
You don't imagine he's gonna be very conscious.
I would
Probably is.
I hope
Probably
not.
is.
I feel like my first reaction would be like, oh crap.
I mean, there could be that sympathy pass out scenario.
I mean, what if he has if he has an open fracture and it is bleeding profusely, you do that first and then the breathing?
Yeah, because that's your most life threatening.
That's what I think.
Yep. And that's what it means. Just don't get sidetracked by
Yeah.
the gruesomeness.
Yeah.
That is
We are
like,
sick and demented people, so we see these injuries and we're like, whoa.
in every single like little yellow box, it's like how to care for things or like how to assess things. That's like the third bullet point down on every single
Yeah,
yellow box.
literally.
We have a scenario, we always say trauma naked. Not necessarily the whole body. So if you have a suspected femur fracture, you're gonna cut the pant legs. Not any reason for me to cut you completely naked. But if it's 20 below zero, do I even want to do that in the field? Or am I gonna just secure them the best we can and load them up and get them in the truck and then? Correct. Depending on your scenario. But you will at some point have to look at it and make a complete examination of it. Compartment syndrome. Compartment syndrome is a critical complication. It's caused by severe swelling in the extremity. The pressure and the swelling within the muscle compartment becomes so great the body can no longer perfuse the tissues against that swelling. You get a whole bunch of blood, you get a whole bunch of broken up tissue, you've got an injury inside of there. So your arm is only supposed to be this big and it only has so much stretch. And then when it gets to the point where it's stretched out to a 10-inch diameter, that skin gets really tight and then you're creating more of a wound. So all of that gets trapped in there.
I just had one of these the other day.
Did you? What caused it?
Well, ultimately, it was the cough syrup he was drinking to get high.
I know what you're talking
Yeah, but we think he must have fallen while he was out of it, and just basically we could see a scrape on the outside, but he couldn't even close or open his hand. It was so swollen. His arm was so swollen.
I believe they suspect, because it wasn't broke,
Mm-mm.
it was just because when he passed out, when he was laying on his
Oh,
arm,
Jim was thinking of stuff.
right, so he decreased the perfusion. So, you know, when your foot falls asleep or your arm falls asleep because you've been laying on it or sitting on it. Kind of the same scenario. You're cutting circulation off. That's why it's falling asleep. That's why you get that tingling feeling. So now he laid on it for,
We don't know. He didn't know.
One time I fell asleep with my arm weird, and when I woke up, I sat up and it was just completely limp. I thought that, you know, it was gonna get chopped off. I was freaking out. But it came back.
so
Very
it's
dumb.
basically like a crush injury.
Yeah, and it was so swollen that there was blisters because there was nowhere else for that fluid to go. So it blistered.
That's crazy.
Sometimes she goes like, I'm catching Glenn, right? Already went through it.
So it's get my foot back. The cellular damage occurs and then more swelling. The loss of blood flow may cause the loss of the limb. So depending on how long, I mean, if he had laid there much longer, there's a good chance he could have lost the whole arm.
Absolutely, and we transferred him to Casper anyway because it was severe.
If you have- Anyway. I'll think of it when I'm not thinking about it.
Right.
Okay, so the pressure and the swelling within the muscle gets so bad that it creates, and the only way to fix the problem, usually the doctor has to cut a slit in to relieve that pressure. So signs and symptoms are going to be pain, swelling, pressure sensation. The extremity may feel hard. It'll feel cold to the touch. PSM will be reduced or even absent, even after you relieve the pressure. Treatment for you guys is cold packs and elevation and rapid transport. So I always say PSM, pulse sensation movement. Your book uses CSM, circulation sensation. Just so we're clear. We get this a lot of times too, even with, what's that called? Grandma fell in the middle of the night and just lay there. She couldn't move. She couldn't reach her phone. Rhabdo. Yep. So she just lay there. Nothing broke, but she just hurt so bad. So she lays in the same spot until somebody comes in and finds it or hears her. So you can get the same thing, even though she's still moving and wiggling around. She's not moving enough, so then she's not perfusing. So then we get compartment syndrome, or you can get, as it progresses, then you get the rhabdomyolysis. Basically, it's renal failure because once you release that, all of those dead cells, where do they go? They go back into your circulation. So then you're creating an even bigger problem. We'll get into that if there is fresh injuries later in your surgery. So, pain and tenderness, deformities, angulations. Do they have crepitus? Swelling and bruising? Are the bone ends sticking out of the leg? Is it an open fracture? Are the joints locked into a position? Can't move. And the nerve and blood vessel compromise. So the 6 P's: pain or tenderness, paler, pale skin, paresthesia, numb and tingling. Some people say paresthesia. Pulses, paralysis or decreased movement, and pressure. Remember your 6 P's. Okay, so think about it. Do the patient's musculoskeletal injuries add up to serious multiple traumas? Good.